Hi, everybody. Good afternoon, and thank you for joining us. My name is Andrea, and on behalf of MoreCare, I'd like to welcome you to our feature webinar today, How to Become Data-Driven to Impact Change in Care Management. We've got a great presentation for you today. It's scheduled for about 60 minutes or so. The first 45 minutes, you'll be hearing from our experts, Beth and Dana, and then we're going to follow up with about 15 minutes to discuss any ideas or welcome any questions that you may have. So before we get started, I do want to let you know that if you have a question at any time and your microphone is connected, you can use the raise your hand feature on the control panel, or you can also type in a question at any time under the question drop-down field on the control panel. So I'm pleased to introduce today's speakers. We have Beth Brand. She's MoreCare's Vice President of Product and Customer Solutions. Beth comes to us with over 30 years of invaluable experience in the healthcare industry. Her experience really ranges. She comes from critical care nursing to clinical informatics and decision support to product expertise. At MoreCare, she provides leadership and guidance to both our customers and our MoreCare team. And prior to joining MoreCare, Beth was a longtime customer of ours actually at Indiana University, IU Health, where she was the director of clinical decision support for the health system. When it comes to reporting and leveraging data, Beth, this is her niche. Beth managed the IU team that was responsible for reporting and being analytics focused on quality and financial outcomes for clinical populations, physician services, hospitals, and the health system as a whole. Now she continues to work with reporting, data analysis, and is always helping clients achieve better outcomes and successful results. So thank you, Beth, for being with us today. And then we also have Dana Beaver-Lewis, our Senior Clinical Solutions Consultant. So for over 30 years, Dana has led her career with care and compassion, immersing herself in helping others and organizations in the healthcare field. On the front line, Dana worked as a quality utilization review coordinator for over 15 years before making the leap to specializing in implementation. In 2004, she joined MoreCare as our clinical solutions consultant, and her combination of hands-on service along with her expertise in hospital quality, peer review, care management, utilization review, risk management, and infection control are an added value in working with clients. Not only does she have degrees in nursing and health information, Dana is also a certified professional in healthcare management and chronic care coaching. So now that you've been introduced to our experts, I'm going to pass it over to Beth.
And just let you know, I actually joined Morrissey in 2004. And of course, my colleague Dana Myers documented 40 years. I haven't been, in healthcare 40 years.
Sorry.
Thank you.
I was delighted to hear that you were older than I was, Dana. Oh, thank you, Andrea, and thank you all so much to all of our participants today. This is Beth, and Dana and I, as you can see, came from the hospital side, and we know very well how busy you all are and how many hats you're probably wearing right now. Time is such a precious commodity, and we want to thank you for sharing some of your time with us. So thank you. What we have planned for today really is a discussion, and we wanted to share with some of you, with you, some of the insights that we have gained through working with our customers as we have assisted them in establishing measurement strategies so that they can determine the effectiveness of their care management programs. So just at a high level, we're going to talk on what does it mean to be a data-driven organization. We're going to look at reporting versus analysis. We're going to dig a little bit into leading versus lagging indicators. Not too deep, but we're going to kind of demystify those. And then we're going to talk about actionable information. How do you get that? And then, of course, we would love to entertain any questions that you might have. So what does it mean to be data-driven? Data-drivenness is about building tools, abilities, and most importantly, a culture that acts on data. And one of my famous quotes from W. Edwards Deming is, "Without data, you're just another person with an opinion." And I personally feel that that is so appropriate. Let's prove it with the data, right? And those of us in the hospital space are very familiar with Dr. Deming and all of his work with process improvement. So the prerequisites for having a data-driven organization start with, of course, data collection. But it's not just any data, it must be the right data. And this is one of the things we work with our customers on, design with the end in mind. So as you're laying out your processes and you're building your processes, think about what it is that you're going to want at the end of the road road how you're going to know whether or not you're being successful, whether or not people are following your processes. Always be thinking about that. And your data has to be relevant to the question at hand. Of course, it has to be timely, accurate, unbiased, trustworthy. In other words, gathered in an automated fashion, right? Versus relying upon subjective data. Data availability. Data must be able to be joined with other enterprise data when appropriate. And I think that a lot of our customers export data from our solutions into larger data warehouses so that they can report on their processes and the nuances of care management in the context of the greater population reporting. We absolutely support that. We think that is so appropriate. Data must be shareable. There must be a data sharing culture within the organization, because siloed data is always going to inhibit the scope of what can be achieved. When more data is available to more parts of the system, the whole is truly greater than the sum of the parts. And then, of course, it must be queryable. You must have, there are so many cool tools out there right now that allow us to slice and dice the data. That's a really important thing, because the first question always is going to lead you to the second, to the third, to the fourth. You have to be able to really query and dig into that information. And then, of course, we want to move from reporting and alerting alone into analysis. So both are important. Reporting is still necessary, but by itself, it's not sufficient for an organization to be data-driven. We don't want to understate the importance of it, but we want to really emphasize that you can't have an effective organization without analysis, right? There are many organizations that focus on reporting, and yet they have little or no analysis. And it's the analysis that's going to say, why did something happen, right? Reporting tells us what happened, but analysis says, why did it happen? Where are my gaps? What's going on? It's prescriptive. But that's not all. And we often say around here, data alone is not what's going to transform your organization. The most important part are still the humans. Still believe this. The humans are essential to understanding, to culling out the right information, asking the right questions, understanding the right linkages of the data, and putting data in the right context. So you have to have human beings, subject matter experts, who have the skills to understand and extract the right data and metrics, and then to use that data appropriately to inform their next steps. All right, now let's talk about leading and lagging indicators, because I think, we hear these a lot these days, and really a leading indicator is truly just a process measure. So these are the drivers that are going to get you to your outcome measures. These are the things that you do in your processes, right? And they help you anticipate and predict what will happen. We all believe that if we follow these certain processes, that then the outcomes are going to improve, right? Lagging indicators, they come later. Those are the outcomes measures. So these are scores or metrics that demonstrate the performance of the organization. These measure the results of the work we have done. So these are things that we're all very familiar with. A score on a particular quality measure, a length of stay, readmissions, etc. So leading indicators are the things that you can influence and control by changing your process. You can determine when you're going to assess a patient. You can determine when we're going to start the discharge planning process, when we're going to place the referrals to our post-acute providers. And by changing those things, we can help to improve or influence our lagging indicators, which are our outcomes. Outcome measures are usually much easier. For those of us in healthcare, we are surrounded by them. We're practically drowning in them. So these are the measures that we use, that are used not only within our organization, but are used by healthcare in general, by our payers, right? By healthcare quality organizations, to demonstrate how well is your organization performing. And then there's also the measures that are within your own organization. So you might have specific strategic goals for the next year that link into outcome measures. So length of stay, readmission rates, returns to the ED, mortality rates, safety events. All of these are very common outcomes measures. Process measures are often trickier to identify. You have to start, and this is where I mentioned before, design with the end in mind. Start by asking how you plan to impact the outcome measures. What are the key steps in your process? An essential thing to remember with process measures is these should be things that you can change and you can influence. So when we look at, this is just a very generic, this is a process flow, very generic. And in most processes, we know that we have different phases. And within each phase of the process, there are interventions or activities or actions, right, that we have identified should occur. And if we follow the process, and if we fulfill all of the interventions or the activities, then what we hope is that we have a desired outcome. How do we apply this to care management? Well, let's think about that. I think that, there are processes that you all have put into place in your organizations that are designed to result in a particular outcome. And they're things we think about every day, but maybe not from this context. So are your discharge plans being initiated on the first day of the stay? That's a process. That's a piece of your process, right? And that will impact your length of stay. Are readmission risk assessments being completed on all patients? That's again another piece of the process which we all believe will favorably impact readmissions and length of stay. Are observation patients being seen in a timely manner? And really, even before that, are patients being placed in the appropriate status right at the beginning? Both of these will impact denials and observation length of stay. Are physician advisors responding to your care managers in a timely manner and appropriately, which will help you impact your medical necessity denials? Are your post-acute provider partners responding to referrals in a timely manner? So are they getting back to you so that you can solidify that placement and do that handoff and get that patient into the right level of care in a timely manner? And then what avoidable delays are occurring? And sometimes this can be, it's really hard day to day when you're fighting the fires and you're in the weeds to really realize that maybe a particular delay is occurring over and over and over again that is something that is impacting your length of stay or could be leading to denials. And it's through tracking that information and then stopping and looking back and seeing, oh my goodness, look at this. Look at how often we are seeing this occur. What if we could take this out of take this barrier out of our processes? So you start with what you have. You start with your processes. Oops, sorry. And I always do that. I apologize. And look to see, are your care management interventions and activities occurring as planned? And then look at your outcomes. Are you reaching your desired outcomes? If not, then perhaps the process needs to be changed, right? Maybe the interventions that you've put in place need to be tweaked. Maybe it's time to make some changes in your process. So we had this diagram before, and let's take a look at that process diagram and think about it from the lens of care management. So, and we'll look at acute inpatient care management. So as the first phase in our process is the admission, and some of the activities that we have outlined that should occur is that the initial review will occur on the first day of stay for all of our patients coming in and admitting to the hospital, that readmission risk assessments are supposed to be completed on that first day of stay. Then throughout the inpatient stay, is the discharge planning ongoing? Is it continuing to occur? Are we updating our discharge plan? Are we making the movement towards getting the patient out to the appropriate level of care? Are delays in service being tracked? And then as we approach the time of discharge, are we placing timely referrals for our post-acute services? Is it being done early enough in the process so that there's time to react and make the right decisions? And then once we make those referrals, are we getting timely responses back from our post-acute providers? And then for many of us, there are processes, part of our process extends beyond discharge. Are we completing the post-discharge calls that we have said should occur for all patients? What percentage of our patients are getting their follow-up appointments with their primary care provider? And if all of these steps in the process are occurring, are our outcomes moving in the right direction? Are we seeing the change in our outcomes that we hope to? So if all the steps aren't occurring, then we need to focus on where the gaps exist, right? And how do we close those gaps? And how do we make sure that our people are following the processes and making sure that it's a consistent approach to every patient? But if what we find is that the process is being followed and the outcomes aren't moving, then we need to take a hard look, and we need to be willing to look at our process and think about how we need to impact change. For any care management program, developing a measurement strategy is essential to demonstrating value. It's essential to evaluate whether or not your program is successful, where you have areas for improvement, whether you're meeting your outcomes goals. But that final bullet there is one that maybe people don't think about very often, but it's how you build support for the program and demonstrate value within your organization. It's essential to be able to show what you're doing and how you're having an impact. We're going to start with just looking at a few examples, and these have actually come from some of our work with some of our customers. I'm going to start with a couple of reports because, as we said, reports are always important. And so this is an example of a customer who was really focusing on their observation review process because they have an issue with their observation patients and getting those patients out of the hospital in a timely manner. And so what they wanted to look at is month by month, and you'll see the months right here. They want to understand how many of the patients who come in as observation and have an observation review scheduled, how many of those are actually getting done, how many of those are being completed within 12 hours, which is what their process dictates. That's part of the cornerstone of their process, is to see those OBS patients within 12 hours. How many are being seen within 24 hours, or the initial review is occurring within 36 hours or greater than 36 hours. And so as we look month by month by month, what will we be hoping to see is this dark blue column here. Those are the ones that we're really hoping will be increasing over time. We want to see the initial reviews being completed within that 12-hour time frame. And if we don't, and if we start to see that slipping, then that's something that we want to drill into. What's happening here? Why is this not occurring like I thought it was? I can't just assume that this is happening. You know, it's the data and the information that's pointing me to where we might have slippage in our process. This is another example from another customer where they were looking for their inpatients and their admission reviews for medical necessity. And again, this is looking hospital by hospital. So this is theoretically, this could be a large hospital system. They have many hospitals in their organization. And what they want to do is look at on a trended monthly basis, they want to look at how many admission medical necessity reviews are being scheduled, how many are being completed, and they've defined what completion means in their world. What is the, how many are being completed within 24 hours? And then overall, what's the percentage of completion versus the percentage being completed within 24 hours? So this is a classic example. This hospital here, what we see is they're getting most of their reviews completed, but they're not hitting the goal of getting those reviews completed within 24 hours. So that's where we want to focus, right? And it's understanding, they don't even have the highest volume. So it's looking at and kind of understanding, you know, volumes, understanding the percentages, and really figuring out what's going on with the process. Now, there might be perfectly rational reasons why this isn't occurring. You know, maybe their admissions are coming in over the weekend. Maybe they don't have weekend care management staff. Those are all valid, but it isn't until you start to look at it and then understand and digest the information that you can make those determinations. Another, we mentioned earlier about how important it is to manage your post-acute partners as you're working towards decreasing your length of stay, decreasing your readmissions. And so understanding where your patients are going after discharge. This is a common report. Probably everybody has this in their organization. But let's just say that we wanted to dig into those patients who are going to skilled nursing facilities. And let's look at which facilities, where are those patients going specifically, right? Which organizations, which post-acute facilities are accepting the majority of our patients, and are they doing that in a timely manner? If we set thresholds and say, you know, this is acceptable performance versus not being acceptable. So if the goal is that we will hear back from our post-acute partners in less than 5 hours when we send out a referral, and we have one particular partner here who's accepting an awful lot of our patients, but is not getting back to us in a timely manner, this is an area of concern. This is where we can drill down, and this is where we talk about actionable information. I now have something I can work with, right? I can go to Oak Bridge and have a conversation and say, we need for you guys to be getting back to us quicker. You could be impacting a whole day in our length of stay for these patients. And likewise with the readmissions that are coming back into our organization, when we've discharged a patient out to one of these facilities, this directs me to who I want to go and have those conversations with. Is there an issue with our handoff process? Do you need more information? Are we not giving you appropriate information about these patients ahead of time? How can we make this more successful? So this has just been an example of some of the reporting that we're doing. What we want to do right now is we want to stop for a second, and we have a poll for you all. We want you to answer a question about whether or not you are currently using dashboards and analytics to monitor your care management processes in your organization. And we're going to take just a few seconds here, and I'm hoping you all can see that. It looks like you are. Okay, this is great. I see. We'll give there's a few more people to answer. We'll just wait another second or two. Okay, well, thank you guys so much. We appreciate you answering our question here. It looks like we have a good mixture. We have a mixture of people who are already using dashboards. We have some who don't, but we also have quite a few who are interested in considering this moving forward. So that's great. We appreciate your feedback. So at this point in time, we are going to, Miss Dana Beaver-Lewis is going to take us in to look at our dashboards. And what we, again, just to emphasize, we believe very strongly that reporting is essential, right? You should never give up reporting, but it's this next step. It's being able to understand where your processes need to be improved, where you need to take action. That's when you have to move into a more analytical framework, right? So at MoreCare, we have a number of interactive dashboards. They're very popular with our customers. And Dana is now going to take us through a review of one of those dashboards.
Absolutely. Thank you. Do you see my screen okay?
We do.
Excellent. All right. Thank you so much. Okay. Well, welcome to our MoreCare Analytics area here. As you can see, we have quite a few dashboards. I am going to just focus on the one for and dashboard dashboard delays today. So I'm going to click on that. Actually, I think I already had it open in the background, so we don't have to wait for it to launch. Okay. So the first thing I want to mention is that when you access our dashboards, we give you the ability to be able to choose if you're part of a multi-facility group or if you're just one facility. So hitting this drop-down arrow, you can either just say, I want to look at my hospital or all the hospitals. And I'm playing the role today of being a multi-facility organization. And so I can also modify what date ranges do I want to look at. So I'm looking at 6 months worth of data here, which is very good, but I can always narrow that down if I notice something and want to really dive deep down into it. So let's talk about our patient visit summary. This is a great area here because I can see what's my patient volume from last year to date to right now. So this is really cool. So I can see how many inpatients we had last year compared to now, same time. Observations. What was my average length of stay from last year to now? And I can see that we're getting better with that. Our average length of stay for our ops, we're getting better. So right off the bat, I can see, wow, like Beth mentioned, we've put in these different processes and now we are seeing the outcomes. And this is all about that actionable information to be able to see. So we're going to start over on the left-hand side here, and I'm going to make this a little bit bigger as I go through the various quads, and we do have 6 quads we're going to go over. This first one here is talking about our patient status changes. So we all know how long we've been struggling with to make sure our patients are in the correct statuses. And so this allows me to see at a high level how we are doing. I can actually press some of these columns here. So I'm going to take away, I just want to look at my inpatient to inpatient and my ops to ops. And this is showing me that we're doing very well. When these patients are coming in, we're making sure they're in the right status at the right time. So we're doing great. And when we talk about different processes that we put in place, I know this might have been maybe 2 years ago, Dana and I was getting a lot of requests to say, hey, how can we, try to help our case managers and our UR folks make sure these patients are in the right status. And so we suggested using an ADA and having a assessment. And we created one for them. It's called Verified Mission Order. And I'm going to say in my world, as my UR staff and case managers started verifying that admission order on admission to make sure it was a patient in the right status, to make sure there wasn't an order mismatch, then this is the fruits of my labor here. So again, that process, my leading was changing our process, and this is showing me, of course, the impact and the lagging is that we are doing great with this. But I also want to see some other areas and see how we're doing as far as when we do have status changes. So I'm going to add in 2 other bars here and take away my big ones. And this is showing me here where my patients went from an observation status to an inpatient status and an inpatient status to an ob status. But and the first one here, I don't mind this too much because, again, this is additional revenue. We did understand that the patient did need additional services. So we had that status change, but the inpatient, the ops is the one I really want to kind of look at, and we're doing great with that. And of course, as I drill down, I can see which ones were Medicare, where we had to, put in that condition code 44 to get that status change. But we're doing a great job here. So again, being able to look at our processes and the impact of it, and this is actionable. And with this chart right here, this quad, I'm very happy as a pseudo director. I'll just advance myself here. Let's go down and look at the next, and I know my Dana Myers, who was a director, is probably saying, yeah, right. So let's look at the other quadrant here, and this is looking at the length of stay of my Medicare patients versus all. Again, just let me look at my volumes here. And one of the first things I'm gonna do is I'm gonna uncheck a couple of these things here so I can see, okay, my overall length of stay, which includes my non-Medicare and commercials and all that compared to my Medicare. And I can see, okay, well, it looks okay, but the difference is that when I'm able to add in a threshold or a target, then I can really see, are we meeting the mark? Are we doing what we want to do? And I can see, nope, not quite. Because this Medicare threshold wants us around 2.5 days. And you can see that we're way above that. Now let's see about the overall threshold. We're doing a little bit better with that. Okay, so again, actionable information to be able to see, we have a problem here. So the thing that I would want to do is I would want to drill down and determine, did we include any psych services in here? Did we include rehab services in here? And if we did, then I can work to get those out of this mix. But again, being able to see where we are, seeing the reasons why we're like this, and making process changes. And in this case, it would definitely be something where I would say, hey, I need to pull out certain services. Okay. So now let's go back up to the top and let's look at some of the UR metrics that we have here. So this is a great area here. Again, this shows the volume of reviews that my reviewer are doing. If at your facility they're doing readmit reviews, then that will show here as well. However, my hospitals are just doing admission reviews, continued stay reviews, observation, payer contact reviews, and post-discharge reviews. So this shows me if there are any trends that are going on. You can see that we're pretty busy and have a high number here. But the thing I really want to focus on are the post-discharge reviews. This is something that we put into place. We had a higher number of readmissions. And this is actually a true story. My director had us to start calling within 24 hours after the patient left the hospital to see how the patient was doing. This is before the whole readmit thing we're talking about in the 80s, but we had the forward thinking to say that when our patients went home, they still were coming back. And so we would do post-discharge review, and I can see that my staff is doing those post-discharge reviews. And as a result, I have seen my length of stay go down, but I can even drill down to my individual reviewers and to be able to see who's doing the most discharge reviews at that time. So again, being able to look at something high level and to be able to drill down and determine why this is happening and how we can make a change is very helpful. Okay, this is showing me by all my reviewers. And as you can see, we are very, very busy. So let's go down to our observation metrics. Another great area here. This allows me to see how we are doing. First of all, how many ops are we getting in our hospital? How many ops by payer or just Medicare? And how many ops are getting out within 24 hours? Or between 25 and 48 or greater than 48. Now, this is telling me that we have a problem here. Did we miss an opportunity to change this patient to an inpatient? Is there a physician that I can talk to? So this is what I want to focus on. I can see, wow, okay, so I'm going to click on April because this is where we had the highest amount here. And again, it's going to drill me down to show me like what units are this happening at. Med surg, is there a reason why it's happening more in med surg than in the surgical area or the women's and children's? And again, I can continue to drill down and see, again, who's the attending physician. Maybe I need to have a lunch and learn with that physician. And meanwhile, I can start watching my charts, my graphs, and seeing this number or this percentage go down and down as I implement new processes or do more lunch and learns that we used to do in the 80s all the time, because I am dating myself. All right, so I'm gonna go back up here to the top. Admission productivity. So this is nothing new. We all, I remember back when I did utilization and case management, they wanted us to do our admission reviews within 24 hours. That was just part of it. We had a 24-hour period, and we did, as a result, start doing, because we didn't meet our mark, we started having weekend coverage. So if this is like what Beth said, you can look and see if we're not meeting our mark, what can we do to make a difference? Can we add in a new process or a new task? But just overall here, I can see how my various organizations are doing with that. More Care Hospital is doing great. They're at 95.5% where the staff is completing their admission reviews within 24 hours. Overall, completing their admission reviews, is 99%. However, I can see down here, Hyde Hospital, they are lagging a little bit. So again, you can drill down into those areas and find out, is it their caseload? Do they need additional training? Are they doing the reviews but not putting them in MCCM? Because we have heard that happens sometime as well. So in order for us to see how things are showing in these charts, we need to make sure we put data in. And I know that some people even attach revenue onto this, initiatives to say, hey, we had a great year, great 6 months. I'm going to treat everybody to lunch or what have you. Okay, so let's drill down a little bit on More Care Hospital. So now this is going to take me down where I can see the productivity by reviewer. I'm going to make this a little bit smaller here. So those of you who use our system, you might recognize some of these columns here as far as what we use to count. So this one is just showing me, this is the number of admission reviews that have been scheduled with an assessment. Okay, so again, every single time when a patient gets in, admission review pops up on my work list, on their work list with an assessment, and here there were 55. Okay, and this is showing me how many times that they completed that assessment with a comment. And I can see we're doing pretty good here. A couple times they did not. And this ADA or assessment would have been that admission verification order. Okay, so again, you can add in these processes and watch and see how your staff is doing it. This is showing me how many reviews were done within the 24-hour time period. And you can see reviewer 1, which must be me, is doing very well, okay, with that. How many admission reviews were done between 24 and 48 hours? Not bad. and how many were done greater than 48 hours, which everybody did pretty good here, but this is pretty much unacceptable. So I would probably have a little meeting with this reviewer as well as this reviewer as well. This column here indicates admission reviews that have not been tackled yet. And then my overall, I can see the percentage that's being completed and a percentage that's being completed within 24 hours. So we're really overall doing a great job. But again, at a high level, being able to see that we need to add in some new processes and procedures. We had one organization, this was a while back ago, they had for an admission assessment, they had like 40 questions for an admission assessments. And she realized that her staff wasn't doing it. They didn't have time to do the whole thing, and things dropped down. Their percentages dropped down. And so they went back, looked at their processes, and let me cut these questions down to a reasonable amount of number. And immediately their productivity went up. So again, let's look at these leading processes and we can see the impact. And of course, that's the lagging. So let's get out of here. And let's go down to our last quadrant, delay types. And of course, we all love to be able to track delay types. This is a great area that we have in our system. This particular chart here is showing me the number of overall delays by delay type. So I have these categories here, and these could be your categories. I have physician, system, external, and ancillary. And I want to look at the physician. So I'm going to click, and there's 108 physician delay types, and it's 30% of my overall delay types, which is the highest amount. So I'm going to click on that, and now it's going to open up for me my delay reasons. What are these reasons for these 108? And I can see the largest one is consultation. So at my organization, the consultation needs to be done within 24 hours of the request or the order. And we're not really hitting that mark. Okay, so this is one I want to really look at. Lack of discharge order documentation. This could cause a delay in discharge, as well as denial in a couple of days if we don't do it. Procedure delay, medical clearance. So all of these kind of equal to money. We're losing money at this point. So I would want to be able to zero in and see who are the doctors, who are the attributing physicians or entities where I can go in and try to make an impact. So I'm going to make this a little bit smaller here. Go up to the top here, and let me go down and make this a little bit smaller so we can see this overall. And so this is the nice area here, because here I'm able to see not only who the patient is, but I'm able to see the admitting physician, the primary payer, the delayed dates, and the profiled MD. And this is a attributing physician, because as you know, sometimes the admitting physician might necessarily be the physician that's holding things up. So this column is very important to me. And I can see that there's 3 days here for Dr. Barnes, 2 days for Dr. Kemp. So I'm able to then sit down with the staff and say, you know, what is the problem? Are you not getting your orders appropriately? Where then it might be a process or a system issue as well. With all of our dashboards and our drill down reports, you can always take these and export them as an Excel if you want to do some additional reporting or massaging of the data. You can export it as a PDF, an RTF, and a CSV. So this is very, very helpful to be able to do that, because then you can take this data and share it with others. Okay, so now let's go back out here. And now we're back to our main area. Now I'll shrink this back down a little bit. So I just want to say, this is, in the end, this is a great tool to help measure your performance over time, and then look at your processes toward achieving those goals by using this dashboard or any of our dashboards. Okay. All right, Beth. So that is all that I have. So I'm going to switch the presenter back to you.
Okay, thank you.
Mm-hmm.
And let me see. All right. Can you see my screen now?
Yes, perfect.
Okay, great. Well, thank you so much, Dana. And every time you walk through that, I take away another little nugget of information. So thank you for walking us through that. We're really excited about our dashboards. We have quite a few dashboards out now in production, and these are really resonating with our customers. So we wanted to kind of dig into one of these today and share it with you. So back to, a data-driven organization. I hope that by now we've kind of outlined that a truly data-driven organization, it really will make decisions using a variety of metrics, but it's really important to focus on continuous measurement, a constant improvement mindset, and being open to updating and refining processes as needed. So a question is your organization forward-looking, and are you treating data as a first-class citizen? And the bottom line is it's important to track both process and outcome measures, right? You have to understand what's happening in your organization and then what changes to make in order to improve your outcomes. So at this point, I don't know, Andrea, if you have gotten any questions from our group today.
Yes, I do. Well, first, thank you, Beth and Dana. That was very informative, and I'm sure it left a little food for thought with those who are participating. I do have a few questions. I do want to remind people as well, a quick reminder, if you want to add a question, you can type it in by using the question drop down on the control panel, or you can press raise your hand if you do have your microphone intact. So the first question that I have for you is, who sets the thresholds or targets for the dashboard?
That's a process. As we implement the dashboards with our customers, it's a there's a process that we walk through, and as for all of the metrics, we will be working with you to understand your process is unique to your organization, because everybody's different, and what your targets are, et cetera. And then those are parameters that we can then load into the dashboard.
Okay, great. The next question I have for you is, can the reports shown on this webinar be shared with other clients so that we can activate those with our own facilities?
Oh, that's a good question. Yeah, absolutely. We would definitely want to have the conversation. As we've said, and those of you who use our solution, you know that it's incredibly flexible, which is awesome. However, it also means that everybody's using a little bit differently. And so a report that is structured to pull the right metrics out of one customer might need to be tweaked a little bit to pull it out of a second customer, depending upon, for instance, what are the criteria by which you determine that a review has been completed, right? Because we all know there are multiple different ways in our system. So little things like that we would need to explore with you. But yeah, we can have the conversation if adjustments need to be made, and those are adjustments that are not within the skill set in your organization, then absolutely we could help and have our reporting team work with you on that. So yeah, we would love to spread these.
Okay, great. So the next question I have is, the dashboard looks really nice, but I didn't see any information on denials on here. Do you have a way to provide information to our organization about our denials management process?
Oh, I'll take that one. Absolutely. We have, and that's one of my second favorite dashboards. It's our denials dashboard, because then you can really pull in and identify, where are these denials generating from? Is it due to the avoidable delays? Is it due to the patient not being in the right status? Is it by a certain service that has an issue with it? We can even pull in the initial and recovery amounts if you're capturing that in your facility. So absolutely, and I think look out later on this year. I think we might be doing some additional dashboard webinars. So please join us, because I'm sure we're going to do one on that as well.
Okay, so I will do a quick look to see if anyone would like to raise their hand. Last call for questions. Going once, going twice. Okay, that looks like it for questions.
Okay.
And then I just want to remind everybody, please connect with us. If you do have any questions or comments following up from this webinar, we'd love to hear from you. I have placed Beth's email here, bbrand@harriscomputer.com. As well, you can always refer to our website. And exciting tidbit, we do have a new webinar coming up. It's with industry expert Tony Sesta. It's going to be on best practice roles, models, and staffing ratios for acute care RN and social work case managers. And that's happening on Thursday, April 30th. So don't wait. Make sure you register. You can register at morecarellc.com/events. And we would love to see you there.
Hey, Andrea, I'm sorry. I think we have someone with a raised hand. I just unmuted Tina's microphone.
Absolutely.
Yeah.
Yeah. Hi, Tina.
Oh. Well, maybe not. Okay.
Okay. Well, Tina, you can
Well,
get in touch if you have any
that's right.
additional
Okay.
questions.
All right. Well, thank you all so much for joining us. And please let us hear from you. We'd love to talk further. If your current care management system does not provide this information, and if you aren't able to use information such as this as you try to run your organization, we would be happy to talk with you one-on-one and to understand more about your current situation and how we could help. So thank you all.
Thanks, everybody. Have a great day.
Thank you. Okay, bye-bye.
Bye.